melasma. We know that it's really bringing a lot of stress amongst people.
Nanocytes and destroying the melasma.
Hi everyone, welcome to our show and a new episode here. I'm your host Simran and I'm so very delighted because today we are going to talk about beauty. Yes, who doesn't want to look beautiful? And with that, we also know that there are a lot of things in the market. We are using a lot of products. We are doing a lot of skincare. Our youngsters are aware of it. Our older generation is also aware of it because everybody wants to look great. And with that, there is a problem called melasma. Yes, my dear friends, this is one of the major issues that we have in certain age. And with that comes pigmentation and comes a lot of things. And what happens? We tend to lose our confidence. We tend to lose the brightness of our skin. There is so much that I would like to know from my guest, who is a renowned dermatologist. And my dear friends, he is also the founder of Aavya Skin Clinic. We have with us Dr. Manan Mehta on our show today. A very warm welcome to you, sir.
Hello, thank you for inviting me. Yeah.
It's such a great honor. I will be talking to somebody who's going to give me tips to how to look beautiful.
Yes,
So I
yes.
would like to start because this is our day to day of melasma. We know that it's really bringing a lot of stress amongst people. Pigmentation. Can you please tell us what it is all about?
So melasma is basically brown patches which start over the face. It has got a centrofacial pattern over the face. Normally it occurs over the cheeks and forehead. It normally occurs during two parts in the female's life. Normally it's seen during pregnancy or after a few years of the pregnancy. And secondly, it's seen in post-menopausal females. That
All
means
right.
females who are nearing their menopause around
Correct.
45 years to 46 years.
Okay.
And this basically causes a lot of psychological stress in females.
Certainly.
So females they tend to be more conscious regarding their looks, and so this causes a lot of stress in them, anxiety in them, and unfortunately it's not very easy to treat melasma. So it's one of the most difficult diseases to treat in dermatology.
Okay, wow.
Yes, yes.
So yeah, you've rightly said that there is a particular age to it. After 45, really notice that pigmentation comes, and of course during pregnancy, a lot of women are suffering that. But I've also noticed that there is a particular skin tone which gets more of pigmentation. Like probably the Indian skin tone. Why not foreigners getting it? Like they are more whiter.
Yes, yes. So basically, skin type 3 and 4 are more prone to get melasma, which is the Indian skin type.
Okay.
In Asian, also, it comes under three category 3 skin type, skin tone, but they are not like Chinese and Korean people don't really get melasma that much often. And it also has to do something with the UV rays.
Okay.
In the Western countries, the UV rays is not that powerful.
Correct.
India nearly comes near the equator, so this UV rays are more penetrating and they are more harmful.
All right.
And also other factors like the amount of sun exposure that also does play a role. UVA, UVB rays जो होती हैं, they also play a role in the pigmentation
All
basically.
right. Okay. So, Dr. Mehta, I would like to know here. The rage is such, everybody wants to look beautiful and everyone's taking good care of their skin also.
Yes, yes.
And before going to any derma, people tend to use home remedies, and if you ask me, I would also be you doing home remedies because it's in the air. Social media is up to it. What is your saying, because you're a dermat? What is your saying? Is it good when you have pigmentation? Shall we start with the home remedy or we should come directly to you?
Home remedies really are not scientifically proven in treatment of melasma. See, melasma is one of the rarest, it's the most difficult skin condition to treat.
Correct.
So, home remedies like application of any kind of lemon or any kind of toothpaste and all that gets more, it's going to complicate the condition more.
Okay.
Yes, yes.
Okay.
Sometimes people also buy over the counter creams like steroidal creams, and there was something earlier which happened. There was like many companies, pharma companies, who were producing a substance called as hydroquinone,
Okay.
which was supposedly uh, meant to treat melasma.
Okay.
But then researchers and scientists, doctors, they used to see that even after using this hydroquinone, the pigmentation used to increase further
Okay.
rather than treating melasma. So then now from the drug regulatory government, it is the hydroquinone has been banned in India.
Okay.
in India particularly, because they found that hydroquinone has a side effect of exogenous ochronosis. That means it increases the pigmentation further.
All right.
Yes, yes. And there were many, many companies who were making a combination of steroid, hydroquinone, and retinoic acid.
Mm-hmm.
All three of them tend to increase melasma rather than reducing. And for 10 years, 15 years, these products were in the market in abundance, and people were using they over the counter available these products like that. Now, recently, 2 3 years back, hydroquinone has been banned in India, but unfortunately, in Western countries, hydroquinone is still going on.
Okay.
So that is why that was also one of the causes for the pigmentation to increase.
Okay. So why is it like that they have not banned in the foreign country, and why is it like that they are banning it here? I mean,
Because probably the awareness is not there.
hmm.
So it is still being. I had gone to Dubai some time back, so
Mm-hmm.
over there it was still being used hydroquinone.
Okay.
So there I raised this topic also in the conference that it's in banned in India. Why it is being used in
Right. Right.
so different countries they have their own set of rules, regulations, and all that is there.
Okay. And maybe of course the temperature and everything that matters.
Yes, yes. So probably awareness has not come yet.
Okay.
In coming time, I think they will also get more aware.
Mm-hmm.
Also, in foreign countries, the skin type is different in Western countries. So
That's
they
right.
have Fitzpatrick one and two skin type. So that comes the more fair uh, skin type is there.
Right.
So in their skin, their melanin component is also less.
Hmm.
Melanin is supposed to be a little protective towards skin cancer.
All right.
So the brown skin, Indian skin is supposedly protective for skin cancer. That's why we never see skin cancer
Skin.
in Indian population. We always see it in European or
Correct.
Western population.
So that way we are saved. Yeah.
Yes, yes. It is supposed to be a little protective.
Right.
Yes, yes.
Okay, so here for my audience, I would like to say that just now Dr. Mehta just told us that we need to be aware of what we are using on the skin. We have a beautiful skin type, and if we go to a dermat, guided well, why not take good care of your skin? So, Dr. Mehta, I would like to know that we've also heard about nutraceuticals.
Yes,
I'm
yes.
sorry, I'm not very well versed with this term because, of course, I'm not aware of this. But I also know that recently you must have heard the news of one of the renowned Bollywood artists. She lost her life, and it is being said that she was, taking anti-aging supplements and a lot of things that she was taking.
Yes,
I
yes.
would like to know all about it. Are these supplements bad for us, or are we not taking it rightly?
So these supplements are actually good for us. It's
Okay.
scientifically proven that all these supplements like glutathione, like for glutathione was actually used for liver.
Okay.
Liver doctors started to use glutathione earlier, and
Okay.
then later on they found the side effect of skin brightness with
Okay.
on the patients of liver. Later on, then in 90s, it was started to use for skin, and
Okay.
they found excellent results with glutathione.
Okay.
Similarly, collagen was also like
Hmm.
used. Collagen is also a good product. Now it is scientifically proven that collagen also helps in skin hydration, skin elasticity, anti-aging. It reduces wrinkles,
Hmm.
but the awareness is not that much regarding collagen.
Right.
There are many other nutraceuticals like there is lycopene, and which is scientifically proven that these medications are good for your health.
Hmm.
Lycopene, for example, lowers your cholesterol level.
Okay.
Yes, lycopene also supports your heart. It reduces your blood pressure.
Oh, that's
There is
wonderful.
one substance called as L-arginine. So
Okay.
this also reduces your blood pressure. But there is, apart from that, there are other nutraceuticals also like astaxanthin, resveratrol. So what you were referring to the incident, I suppose the person must have taken high dosages of many compounds. So,
Okay.
but the thing with nutraceuticals is there is no regulatory body for regulating these health supplement companies,
Okay.
because any company can register themselves and they can take out the standard product and they can combine many combinations, because there is no regulatory body regulating these health supplement companies. So
Okay.
there are thousands and lakhs of companies, people who are actually making these health supplements. Though it's not bad,
Mm-hmm.
it is actually good for your health,
Mm-hmm.
but the dosage is also not regulated. So
Mm-hmm.
glutathione, I can give 500 mg in a day. I can give up to 1000 mg in tablet form also.
Okay.
There are people who take IV 2.5 grams also.
Okay.
IV. They can go up to 5 grams also. So there
Okay.
is the dosage part is a bit confusing for doctors as well. There it's confusing for the regulatory bodies also, because
Okay.
there is no guidelines which can really tell that how much is safe dose and how much is unsafe dose.
Okay.
Even if you take 2000 milligrams of glutathione, sorry, I won't say that it is going to be bad for your health,
Okay.
because how glutathione works is it's detoxifying your toxins in your body, and it's basically helping in regeneration also.
All right.
So also some of the other like nutraceuticals which I mentioned, there is one thing called as astaxanthins, lycopene is there, like that. So how they work is basically they help in go in the DNA level.
Mm-hmm.
They go in the DNA level and change the DNA in the cells.
Okay.
They help in the uptake of the fats. There
Mm-hmm.
is one thing called as another nutraceutical called as L-carnitine.
Right.
So this basically helps in fat burning. Whether
Okay.
you work out or you don't work out, that is irrelevant, but it will start the process of fat burning in your
Mm-hmm.
body.
And that's
And
quite common these days.
it's common, but awareness is not there.
Mm.
And how much to take, there are no proper guidelines to on this market. It's a very big market of
Mm.
nutraceuticals.
Right.
And in fact, scientific studies have even proven now something called as probiotics.
Correct.
Probiotics is also good in for your skin. It's good for acne patients. It's good for eczema,
Okay.
because certain sometimes we do see new papers have come out that which prove that probiotics are helpful in eczematous skin conditions.
Okay.
Yes,
Okay.
yes.
So, like you said, that glutathione was initially recommended by doctors to
Liver
actually for the
doctors.
liver
Yes,
doctors.
yes.
So, anyhow, I would really see it as something which is clearing our gut. This is the problem that we have majorly. If our gut is clear and of course
Mm-hmm.
it is pure, I think it reflects on your skin,
Yes,
right?
yes.
And here again, once again, I'm going to tell the audience here that you need to be aware of what you're eating and, like, how many mg, the right usage of medicine. Of course, these are very, like you said, the supplements are good.
Yes, it is
We
actually
must take.
scientifically proven that these are good for your body.
All right. So if they are good for you, but you must know under the guidance of your dermat. Now, moving
Yes.
further, doctor, I would like to know here that melasma, of course, we are talking about it. Is it curable? Like, we've been applying a lot of creams, doing a lot of, IVs and whatnot. There are a lot of things, lot of other
Yes,
things
yes.
that are available, treatments. Is it curable?
So, melasma is a chronic skin disease and it does tend to recur a lot.
Okay.
But there are new technologies in the market also, which I also use, called as Pico technology, Pico laser.
Okay.
And this laser is very much advanced than the previous laser. It's 10 times more effective than the Q-Switch lasers.
Okay.
So this helps in killing the pigmented cells, melanocytes,
Mm-hmm.
and destroying the melasma.
Okay.
But also what I am also doing is I also do treatments for skin pigmentation reduction.
Okay.
So I do reduce the pigmentation. Many times many patients of mine have changed their skin color also,
All right.
which is a bit controversial to speak on, but
Mm-hmm.
yes, I do take guarantee that I can change and reverse the skin color of patients.
Okay.
Yes, yes. And there are many of my patients who are very
Dark color, or maybe.
who are like kind of very celebrity kind of people,
Okay.
and they don't want to, and their skin color has been changed.
Okay, wonderful.
Yes, yes, yes.
So, you're just making everybody's dream come true to look beautiful. Fair skin is what we look up to. This Indian mentality is such. I
Yes,
know.
yes, yes.
And then you're helping them.
Yes, I am helping them. I'm helping patients for their cosmetic features, and I'm enhancing their looks.
Mm-hmm.
And I also tell my patients that how much pigmentation do you want to reduce, and how much fair you want to be. So sometimes some patients say that I want to be like the wall color white paint. I say this is also possible.
Oh, wow.
There is no limit in the possibilities what we can do.
Mm-hmm.
We also do like sometimes chemical peel and other
Right.
things like chemical peels and
Mm-hmm.
glutathione later on. They
Okay.
also do help. Glutathione is also supposed to be very very good.
Okay.
But this laser basically destroys your melanocytes,
All right.
and then your over a period of time your skin your body removes this kind of dead pigmented cells by a process of phagocytosis.
Okay.
and then your pigmentation starts to improve.
Okay, that's wonderful.
So, but generally, in two conditions, I found another like recurrence. One is the pregnancy,
Mm-hmm.
because I think there is some pathology of increased hormones, increased
Mm-hmm.
female hormones like estrogen, progesterone, which tend to produce melasma again.
Okay.
And also during postmenopausal age group, when the something dysregulation is there with the estrogen progesterone, that's why we see melasma also commonly with people who take OC pills,
Okay.
oral contraceptive pills, people
Mm-hmm.
who smoke a lot.
Mm-hmm.
In them also we do see melasma commonly.
Okay.
So but yes, melasma is treatable. It's not, if you go to the right doctor who advises you rightly, it's completely treatable.
That's a great news. And here again, audience, melasma is treatable if you go to the right doctor, and we have that right doctor right next to us. Dr. Sab, next question is,
Yes.
does lifestyle matters? Like you were just saying, people who smoke, I mean, all these matters, like erratic schedules, I mean, majorly,
Hmm.
does lifestyle matter in having melasma?
Yes, of course. See, if you have a good lifestyle, your chances of melasma are going to be less only.
Mm-hmm.
So, if you sleep a lot, you drink a lot of fluid, you have the right kind of food, you have the right kind of fruits, salad in your diet,
Mm-hmm.
proper nutrition, even micronutrition is very important. Sometimes I see a lot of patients for hair fall also, and I do find like most of them are vegetarians. So the
Right.
only difference scientifically proven between a vegetarian and a non-vegetarian is that non-vegetarian food is rich in vitamin B12,
Okay.
and that's why non-vegetarian people are like their hair will be good if you see them
Hmm.
like that.
All
So in
right.
vegetarian diet we see vitamin B12 is not there.
Mm-hmm.
Really, it's very difficult to get vitamin B12.
Okay.
That's why we give them supplements for vitamin B12.
Okay.
Yes.
So again, people who are vegetarian, you have to find more options, and the of course non-vegetarian people are anyhow having a good hair and stuff. And
Yes,
of also
yes.
it does reflect if we have a non-vegetarian diet. Does that reflect on our skin also?
Yes, of course, it's rich in proteins.
Hmm.
Non-vegetarian food is rich in proteins, rich in other kind of amino acids also,
Hmm.
which sometimes we see is lacking in vegetarian diet.
All right.
That's why a lot of people also do go to when they go to the gym, their gym instructor also advises them for extra protein.
Protein. Correct.
All
Correct.
these manufactured proteins are there.
All right.
So non-vegetarian food is rich in protein also. That is also there.
So there's another big question that I have in my mind, which is
Mm-hmm.
chemical peels and laser treatments, which
Yes.
you are like saying that they are very good.
Yes.
But there are a lot of myths amongst people that, of course, this may have a reaction to it. If you have a laser done, it may have a reaction to it. How true is this?
It is true, because sometimes there are so many people nowadays. Chemical peels is being done in parlors also. Even
Correct.
Q-switch lasers is being done in saloons and all that. So people who are not trained or don't
Hmm.
have any training, and they are the technicians are just doing it. So it can be very dangerous, because
Hmm.
chemical peels come in different kind of forms and different strengths also. Like there is glycolic acid, salicylic acid, party peel, so many peels. Sometimes we see that a peel has been done and a reaction has occurred to the patient.
Hmm.
So if a reaction does occur, it's very difficult to get the skin back, because the
Correct.
marks will be formed. Then post-inflammatory hyperpigmentation will be there.
Hmm.
Sometimes I see a TCA peel has been also done on patients, which is very strong. So it has to be done with people who have proper training and proper experience.
Hmm.
Similarly, with the lasers also, if
Hmm.
the person, the technician, does not know how much energy to be put in the laser machine and how
Hmm.
many shots or frequency has to be put, so they can actually burn the skin.
Okay.
And sometimes if you actually burn the skin, there can be burns also in the skin. So it can be like burn, first degree burn, second degree burn, like that. So everybody has to be very cautious while doing lasers and chemical peels. Normally I do chemical peels for 1 to 2 minutes only, not more than that. And
Okay.
preferably a medium strength percentage, like glycolic acid 45%, 30%, which is generally safer, like
Okay.
on the patients. Yes,
So,
yes.
what are those IV drips when you say that, there are times I've seen a lot of influencers, and I would like to come to them.
Yes.
They've also been promoting a lot of skin clinics, and they said that anytime I want to feel rejuvenated, I want my skin to glow, I go take a IV drip.
Yes,
How
yes, yes.
recommended? like is this?
So this is basically glutathione only what they are talking about. IV drips is recommended, but it's recommended in the regular dose, 1 gram up to 1 gram, 1.5 gram. You can go up to like that. You can also
Okay.
go up to a 500 mg IV.
Okay.
It's the same thing as having a tablet of glutathione. It works the same way. It replenishes your liver,
Mm-hmm.
and it basically detoxifies your liver,
Mm-hmm.
glutathione, and it helps in anti-aging.
Okay.
Yes, yes. Other substances now are also much more powerful than glutathione, which are also now in the market,
Mm-hmm.
but they are not come yet that much in India.
Okay.
One of the product is called as astaxanthin.
Okay.
This product is around 1000 times stronger than vitamin C,
Okay.
more powerful than 1000 times.
Mm-hmm.
So you can see the antioxidant effect it has, astaxanthin,
Mm-hmm.
over the body.
Mm-hmm.
But in India, it's going to come now properly in some time. There is another substance called as resveratrol. So both
Okay.
astaxanthin and resveratrol are actually they are also used as oral sunscreens. So
Okay.
just like topical sunscreens, there is something called as oral sunscreens,
Mm-hmm.
and these products come into that.
All right. Now you talked about sunscreen. Now this is also one of the most important layer that we should be putting, because of course we have here in India the climate is such.
Yes,
So
yes.
what is the kind of SPF recommended for Indian skin?
SPF up to 50 is recommended for Indian skin. If you can afford and you can find brands which are having higher SPF,
Okay.
like SPF 75, SPF 100, then that is also better.
Okay.
SPF 100 is also better than SPF 50 scientifically, but it's around zero point 0.5 to 1% better than SPF 50. Because above SPF 50, you can go up to any SPF, that does not matter, but the difference is very subtle.
All
So
right.
SPF 50, if you can buy, so it's not a problem. It's sun protection factor basically.
All
Yes,
right.
yes.
Now, like I talked about influencers, we also see
Mm-hmm.
that social media has a rage.
Yes.
People are following them. You know,
Mm-hmm.
any product they are, promoting on the screen, people just go buy it without even thinking twice because it's been promoted by an influencer.
Yes,
And of
yes,
course,
yes.
when they say it, we tend to believe them. But
Yes.
here comes, risk also. Like it could not be good for my skin until I
Mm-hmm.
speak to a doctor. Now,
Yes.
what is your say? Like, if you have to give this to the audience here, like, do they should directly listen to them, or they should consult a dermat?
They should consult the dermat,
Mhm.
definitely. They should consult the doctor, and just don't buy any product just by the looking at the ad, because it can be later on found out that the product is fake, or the
Mm-hmm.
product is manufactured, the chemicals used in the product is not safe for you. These
Mm-hmm.
things quite happen. Like for example, I told you that there were triple combination creams in the market which were running and anybody can buy it. Later on they found out that hydroquinone has the side effect of exogenous ochronosis.
Okay.
Similarly, there are many products in the market. You should also always consult your dermatologist,
Mm-hmm.
and who will guide you properly.
Right.
Yes, yes.
Okay, so here, my dear audience, coming back to you and telling you this is the fact that in case you're facing melasma, it's one of the major thing, and of course, it hampers your confidence also. Please do not follow your influencers just blindly. You have a dermat, you have a proper doctor here who would just let you know which is right thing for your skin. So Dr. Mehta, we've heard a lot of about the skin type, and I would like this to continue forever, but towards the end I would like to have one advice from your end, or maybe advices from your end towards our skin regime, what people should follow to have a good skin.
People should basically apply a good sunscreen. They should moisturize their face. They should have a good sleep, and they should have a good diet rich in minerals, vitamins, and fiber. And they should take less stress in their lives, basically.
What a precise answer. This is the fact that we should take less stress, sleep well, and be happy all the time, and therefore that shows on your skin.
Yes.
Thank you so very much, doctor. I mean, we can go on and talk about it, but of course, we need to end it because we may meet soon and talk about another topic. Thank you for coming here and bestowing your knowledge to us.
Thank you. Thank you for inviting me.
Thank you. And my dear audience, I'm sure that you've got all the knowledge about how you can cure melasma. You need to contact Dr. Mehta in case you're facing it. Till then, Simran signing off. Shall meet you soon. Stay blessed.